Today's topic is preventing falls, and I will offer helpful tips on how to prevent falls. So get your pen and paper ready, and we'll offer you some tips as we go through this presentation. Next slide, please. So, San Diego County has a fall prevention task force, and our mission is to reduce falls and their devastating consequences for older adults in San Diego County. This task force has been around for close to 20 years. I've been an active member since 2006. I did previously serve 8 years as the co chair of this fall prevention task force, and now I'm an active member but no longer the co chair. Right now, this is a partnership between the San Diego County Aging and Independent Services, along with private healthcare providers and other businesses in San Diego that provide fall prevention related services to the residents of San Diego County. So we meet monthly. In fact, we just had a meeting yesterday on Zoom from 1 to 2 p.m. We do meet once a month on Zoom. So if you ever want to jump on that call, we would love to invite you. And I do have information at the end on how you can contact the leaders of this fall prevention task force. Next slide, please. We're going to start off today looking at some myths that are commonly shared among people regarding falls. The first myth is that muscle strength and flexibility cannot be regained. So a lot of times people just sort of feel hopeless as they're getting older and they feel weaker, or they're getting more stiff, more achy, and they feel like, oh, I just can't get stronger. I can't get more flexible. But the truth is that even though loss of muscle strength is part of normal aging, through exercise, muscle strength and flexibility can be regained. The second common myth is that if someone restricts their activities and stays home, they can prevent falling. For example, it's common if an older adult has a fall that one of their adult children may say, well, mom, you know what? Just stay home. I'll have your groceries delivered. You don't have to go out anymore. And that way you don't have any more falls. That's just an example. And so an older adult may start staying home more often if they're falling. The reason that's a myth is because most falls occur by slipping or tripping on a level surface inside your own home. So therefore, staying home does not necessarily prevent falling. The third myth is that falling is a normal part of aging. And while we do see falls occurring more often in the aging population, that would be people over 65 are falling more often than their younger counterparts. Falls are not necessarily an inevitable part of aging. And so if somebody does fall, an older adult, we want to take steps and implement these helpful tips to reduce the risk of more falls and ultimately reduce the risk of injury, pain, suffering, disability, or early mortality related to falls. Next slide, please. So we'll look at some statistics. One key point here is that when I first started doing these kind of lectures around San Diego County back in 2006, these statistics were a little worse. So it used to be that 1 in 3 older adults reported falling every year. But I think now that more information is getting out there to the general public and healthcare providers regarding helpful tips to prevent falls, the statistics are looking a little better now. So now it's about 1 in 4 older adults that report falling each year. And this is not necessarily people who sought out medical care from a fall. This includes information from a health survey that's taken over the phone, where they just call a sample of older adults and interview them about their health information by phone. And so that's how this information is gathered. It's not representative of the number of older adults that sought medical care for fall related injuries. We current statistics estimate that about 20 to 30% of people who fall will suffer moderate to severe injuries that will prevent them from ever returning home or living alone again. And we're talking about there would be like a brain injury, broken shoulder, broken hip, spinal fracture with resulting paralysis, and things like that. So there are a percentage of folks that then also sustain minor injuries, such as a skinned knee, a bruise on their wrist or forearm, scabs on their palms, um, so bumps and scrapes and bruises that don't necessarily require medical care, but still hurt and can cause a big inconvenience. And then, of course, there's a group of folks in this number that fall but are not injured, luckily. And so they don't seek out medical care. And honestly, a lot of them don't tell anyone. So that's a point that I hope to drive home today, that if you are falling or you have an older loved one who's had a fall, you got to talk to the doctor and try to implement some of these helpful tips. Don't keep it a secret, because of the next statistic on here, which is that if an older adult has had one fall, that automatically places them at a higher risk of future falls. In fact, it's estimated that about 50% of older adults who fall will fall again within 6 months. And so we want to look at taking that first fall as a wake up call to talk to the doctor and implement helpful tips to try to prevent future falls. Next slide, please. So, what we're going to cover today are helpful tips within 4 main categories. The first category is speak up. That has to do with advocating for yourself in the medical system. The second tip, or the second general category that we'll look at tips, is to keep moving, to stay active. And that's because loss of muscle strength as well as muscle atrophy are normal parts of aging that we need to actively fight back against those. The third category is to check your eyes. And then the fourth category is to make your home safer. And what we've learned through research is that, for example, just making your home safer as a standalone intervention doesn't really reduce the risk of falling very much. It can to some degree. But when we look at implementing helpful tips in all of these categories, it actually it reduces the risk of falling exponentially. Next slide, please. So the first category we're going to look at is to speak up. And this has to do with talking to your doctor. Everyone has a primary care provider, whether that's a physician assistant, a nurse practitioner, or a medical doctor. And you do see them, typically you're going to see them once a year for your annual physical or your annual wellness check. You might see them to get your prescriptions renewed. But if you have a chronic health condition, you want to make sure to see your provider, your primary care provider, regularly to ensure that your chronic health condition is being well managed. For example, high blood pressure. High blood pressure can change, especially if somebody gains weight. So if they gain weight, their blood pressure might go up. Therefore, their medication might need to be adjusted. Likewise, if somebody loses weight, their high blood pressure may come down, may even go down to a normal amount, and therefore the doctor may want to taper them off of medications. So the general rule is, if you've gained or lost 10% of your body weight, make sure that you schedule a follow-up with your primary doctor to check the dosages of all of your existing medications. Some of them may need to be changed. And as well, if you have a chronic health condition, talk to your doctor about your part in managing it. For example, a lot of my patients with high blood pressure, just to stay on that example, they have a blood pressure cuff at home, a digital cuff, and they check their blood pressure once a week or on a regular basis as their doctor recommends. in order to make sure that their medicines are working. Some people use medication pill boxes to make sure they don't miss a dose. It's really easy to forget to take medications, or they'll have a sheet that they make a note each time they take their medication, because medication errors or missed dosages can also wreak havoc on chronic health conditions. So we want to speak up regarding meeting with our primary care provider about our chronic health conditions. Recognize that may need to be more than once a year. Make sure your medications are the correct dosage. Let them know if you've gained or lost a significant amount of weight. And then just thinking about, what chronic health conditions am I talking about here that put older people at a risk of falling? I mentioned high blood pressure, but just think for a minute, can you think of anything else? I'll give you some examples. For example, Parkinson's disease, a history of a stroke or MS. So, any neurological condition can increase the risk of falling. Any cardiac condition, any problems with the feet, so arthritis in the legs or the feet or the knees, neuropathy in the feet, any fluctuations in blood sugar. So even something like diabetes can cause people to fall if they're not well managing their blood sugar and they're having episodes of lightheadedness that can trigger falls. So we want to look at any chronic health condition and make sure we're managing it well. One problem we have in the healthcare system today is that a lot of doctors don't have enough time to teach you what to do to manage your health conditions. So we in San Diego County have free classes for people to learn how to manage their chronic health conditions. And I'll give you the resource for that at the end of this presentation. It's offered through the county. It's an evidence-based program. One is called Healthier Living with Diabetes. One is called Healthier Living with Chronic Pain. And one is called Healthier Living with Chronic Health Conditions. And that's really for any health problem that you might have that you need to learn how to manage beyond what your doctor has time to teach you. Next slide, please.
We have a question from Henry. Are you able to take questions from David?
Let's say, if you don't mind, let's save it to the end. Can you make a note of what that question is, Vanya, and then let me know at the end?
Yeah, Professor Paul will call on you at the end.
Okay, thank you so much. So the solution to dealing with the chronic health conditions and the medication issues is really speaking up when you go to your healthcare provider. Now, why is that important? Because they only have a limited time, and they have certain questions that they have to ask you based on what your insurance requires for them to report. And so, you may run out of time for the visit and not get a chance to talk to them about things that are on your mind. So I usually recommend for you to make some notes about what you want to talk to them about or questions you have, and bring it with you to the appointment. And also, you can bring somebody with you to the appointment, like an advocate that can help you speak up so that you can get the benefit from working with your primary care provider to reduce the risk of falling that might be caused by chronic health conditions or certain medications. Next slide, please. Okay, so this is just some examples of questions that you can ask your healthcare provider. For example, can my medication contribute to a fall? How are my current health conditions affecting my risk of falling? You can ask them if you need to be referred to a neurologist or an ophthalmologist or a cardiologist or even a mental health professional, because even conditions like depression can contribute to falls if someone's not taking their medicine properly because they're suffering from depression. And so sometimes even mental health interventions are important to reduce the risk of falling. You can ask them for referrals if needed. Now I'm on number 3. You can ask your doctor if you would benefit from receiving a referral for therapy, such as physical therapy or occupational therapy. You can ask your doctor if you are taking the proper supplements. For example, A lot of people supplement calcium, vitamin D, vitamin B12, and this would largely be based on your blood work, your annual blood work, if you have any deficiencies, and your diet, what you're eating regularly. So your doctor may recommend certain supplements, and then you can ask the doctor about your exercise and fitness plan. Are these certain exercises appropriate for you? We want to look at exercise in 4 different categories: strength, balance, flexibility, and endurance. And if you're not sure about exercise and your doctor's not sure about exercise, that would be an appropriate time to refer for physical therapy, because physical therapy are basically exercise specialists that can design a program that's appropriate for you given your medical history, your surgical history, and your current medical conditions or pain, etc. Next slide, please. Typically, the annual Medicare visit requires your primary care provider to ask you these questions regarding falls. They're supposed to ask you if you've fallen in the past year, if you feel unsteady while you're standing or walking, and if you worry about falling or if you experience fear of falling. And typically, these questions are required by Medicare annually. And then if any of these is a yes, then that would trigger your doctor to do certain interventions to try to reduce your risk of falling, such as referring you to physical therapy. The key thing for you to know here is when your doctor asks these questions, make sure you tell them the truth. So a lot of people try to minimize what's going on or hide if they're having falls or afraid of falling, but make sure you tell your doctor the truth when they ask you these questions so that you can speak up for yourself and get the services and the care that you need. Next slide, please. The second category that we're going to look at is the importance that you keep moving. A lot of people, when they move into retirement, they adopt a sedentary lifestyle. And so they end up watching more TV, watching more news. Like I can tell you, my grandpa, who's one of my best friends of all time, and he's glued to the news all day, and it's been hard for me to get him up, get him active, and remind him he's got to keep moving, or his muscles are just going to wither away, unfortunately, because of normal aging. And so having an active lifestyle is really important in retirement. And this can be puzzling for people who have never needed to exercise before in their entire life. But yet, because of normal aging, it is important to exercise when you're retired so that you can fight back against the loss of muscle strength and the muscle atrophy that can occur from physical inactivity. Next slide, please. So the first thing we want to look at to stay moving is making sure you have proper footwear. A lot of times dress shoes, like if you're going to go to the theater or go to the opera or symphony or something like that, dress shoes are usually not a good idea because they do increase the risk of falling, such as high heels for the ladies. And then for the guys, the dress up shoes that have a slick bottom. I've met more than one patient who's fallen in the parking garage of a symphony or a theater because they were walking in these type of shoes. So you want to make sure that you pick shoes that have a thin, non-skid sole and that securely fasten to your foot. So slippers and flip-flops are not ideal unless they have a heel strap that comes around the back and holds them securely on your foot. Otherwise, they could slip off. And then the problem with the shoes in the middle of this slide is that the sole is too thick and the shoe is too heavy. So this is going to throw off your equilibrium from having a really thick sole. So you want to have thin, non-skid sole of a shoe that securely fastens to your feet for optimal footwear. And I will comment that with normal aging, typically your feet are going to get bigger and maybe wider. So when you buy new shoes, make sure you get your feet measured so that you can have the right size of shoes each time you purchase a new pair of shoes. Next slide, please. And regarding keeping on moving, I had a lady at one of my live talks on this same topic. It was at the Bonita Library, probably like 10 or 12 years ago. And she raised her hand and she said, I clean my house from top to bottom almost every day. I sweep, I vacuum, I dust, I do the dishes, take out the trash, et cetera, et cetera. She said, does that count as physical activity? You bet you it does. So even housework, gardening, cooking, anything where you're up and you're moving around and you're moving and using your muscles counts as physical activity. So that will combat the tendency to have a sedentary lifestyle. Now, that's not to say that resting and watching a show or watching a movie is not okay. Of course, that's okay. But you don't want to be doing that, 8, 10 hours a day. So you want to have activities throughout the day where you're up and you're moving around and you're doing things to keep your muscles strong. And then you want to have an actual fitness or exercise routine that involves those four components of fitness I mentioned: strength, flexibility, balance, and endurance. You can work out, exercise by yourself. You can exercise with a partner, in a group. You can sign up for a class. And actually, at the end of this talk, I will share with you again, the County of San Diego has free classes for Tai Chi and an exercise program called Feeling Fit. So you could go to a Feeling Fit class that's offered for free by the county at one of many locations. You could order videos from the county that will be mailed to your home with exercises for the Feeling Fit Club. These exercises can be done sitting in a chair or standing. And if you order them from the county, they'll send those to you on a DVD along with a fitness band to do at home on your own. You could work out with a personal trainer, or you could get started exercising with a physical therapist if you're not sure what to do or how to get started. So those are all good options to implement an exercise and fitness routine into your retirement. Next slide, please. And again, I just mentioned to work with a physical therapist to get started. This is more for people who have maybe ongoing health conditions or pain, or just had some kind of surgery and they're not sure what exercise they should do, what is safe, what is appropriate. Of any physical therapist will be able to get you started by designing an exercise program for you and work with you over a period of weeks to get you going. And then eventually you'll be discharged from physical therapy where you can continue exercising on your own with the plan that was set up for you by the physical therapist. Next slide, please. So you can receive physical therapy in the privacy of your own home through Medicare Part A if you're homebound, meaning it's a considerable taxing effort for you to get out of the house. Your doctor can order home health for you physical therapy through Medicare Part A. That would be covered 100% with no out-of-pocket cost. And then if you're not homebound, but you would still prefer to receive physical therapy in your home, there are a number of companies in San Diego that provide what's called Medicare Part B in-home therapy services, where the physical therapist will still come to your home, but it would be covered by Medicare Part B. And therefore you may have to pay a copay, and there may be an annual limit, like 20 visits or something like that a year approximately, and that varies company by company. But that would also have to be referred by your doctor to get coverage. And if you have a managed plan, like a Medicare plan that's a managed plan, you would have to get pre-approval for any in-home therapy to be covered. A lot of these companies, the Medicare Part B companies, will offer in-home therapy just out of pocket. If you pay cash or check or credit card, then you can have therapy in your home. And if you want to go out of the house to get your therapy, you can go to a hospital-based clinic such as like UCSD, Scripps, Sharp, Palomar, Tri-City, Sharpry Steely. I think those are kind of the major ones in San Diego County. They all have physical therapy clinics in the hospital that you can come to from your home to the hospital to get your therapy and then go home afterwards. And that would be, again, covered through insurance. But typically that has, it's not subject to the same caps, annual caps. So you might be able to go longer to a hospital-based clinic. And then the other option is you can go to a clinic, like a freestanding physical therapy clinic that's not based out of a hospital. It's just somewhere out in the community. And again, that's usually going to be through Medicare Part B with an annual cap or private pay. So those are different options. Like my company, for example, we do house calls and we have an office in Encinitas that people can come to. So I have a little bit of a hybrid model of care where I can accommodate somebody that needs an in-home visit and also someone that wants to come to an office to get treated. So a lot of private practice physical therapists like myself do offer hybrid options like that. So regardless, you can talk to your doctor about getting a referral if you want to go through insurance. But if you want to go directly to physical therapy without insurance and just pay out of pocket, you can just look online and find a provider that you want to work with and go directly to them. Next slide, please. And again, I'm talking about getting started with exercise so that you can keep moving as you're aging to prevent falls. This is a huge exercise is a huge component of fall prevention for older adults. And so what I want to let you know about right now is a specialty within physical therapy called vestibular physical therapy. And there are vestibular providers at all the major healthcare systems throughout San Diego, such as Sharp, Scripps, UCSD, Sharp, Steele, Palomar. They all have vestibular physical therapists in-house, very limited in number. So it's a low amount, just very few. But these are specialists who can help you if you're having dizziness or vertigo or persistent balance problems. So for example, say you went to physical therapy and you did, 15 visits and you did all your exercises, you did all the strengthening, and yet you're still falling. Well, then you should get your vestibular system checked because you might have an inner ear problem. So the word vestibular means inner ear. This might cause you to fall even if your muscles are strong. And that's a key point to not lose hope. If you've done traditional physical therapy or you're exercising regularly and you're nice and strong, but yet you're still falling, you should be checked for a vestibular problem. This is what I specialize in doing. And like I said, there are physical therapists throughout San Diego that also have the same specialty based at different clinics and hospitals. Okay, next slide, please. So the key thing, if you are having falls, is what's called a root cause analysis. So we need to figure out, why are you falling? What's preventing you from continuing to move safely without losing your balance? And so we're going to look at your feet, your inner ear, your eyes, and check all these different systems of your body to figure out why you're still falling despite staying fit, continuing to move, continuing to exercise, and being relatively strong. Go ahead, Vanya. Next slide. And so the physical therapist is going to do a hands-on exam. The vestibular physical therapist does a hands-on exam to check, for example, your inner ear balance reflexes and other functions of balance that might be impaired and contribute to falling. A hands-on exam, in my opinion, is a unique skill within healthcare today. I know a lot of patients that have been to a lot of doctors and no one's put their hands on the patient to actually examine the patient hands on. And the interesting thing about the checking for balance problems related to the inner ear is that a hands-on exam is actually superior to brain MRI and all this other fancy testing with fancy equipment if you see a provider that's skilled and knowledgeable in how to assess your vestibular system with a hands-on physical exam. It actually reveals more typically than fancy testing, and it's less expensive. Next slide, please. So here's how you can find a vestibular provider. I specifically mentioned vestibular physical therapists, but there are some doctors that also specialize in vestibular. I would say those are fewer and further between. So there's more vestibular physical therapists in San Diego County than there are vestibular doctors, but you could go to either one to get started. You can look online at this nonprofit Vestibular Disorders Association. Their website is vestibular.org. And when you go on there, you scroll down a little bit and they have a button to click that says find a specialist. And then you click find a specialist, and then you'll be on their healthcare provider directory page. And then you can put in your city, state, and zip code and select the radius that you'd be willing to travel, like 20 miles or 50 miles, and then hit, search, and it'll pull up for you a list of vestibular providers within that area. So you would look for somebody like this if you're having chronic repeated falls without a decent explanation, or if you're having dizziness or vertigo that's unresolved and unexplained. Next slide, please. So that was regarding how to keep moving. Now, the third category we're going to look at is poor vision. So we really have three things that go on with older adults. We have normal aging of the eye, which affects everybody over 65. This, for example, is a change in depth perception, decreased contrast sensitivity, so maybe difficulty seeing the edge of stairs, change in color perception. So these are all normal parts of aging that everyone's going to experience. And that's why we want to get our eyes checked at least once a year. So an annual eye exam is recommended. If you have diabetes or high blood pressure or another health condition that may require more frequent eye exams, your doctor will tell you that. And then we have eye diseases. So the four major eye diseases, macular degeneration, glaucoma, diabetic retinopathy, and cataracts. Those are going to be more common in older adults. And so your annual vision exam is going to typically be with an optometrist that will check your glasses and make sure your glasses are correct. And then if you have an eye disease that needs management, you'll probably also see an ophthalmologist for regular checkups. That's a medical doctor to manage the eye diseases. First eye cataract surgery is associated with a reduced risk of falls in people who have cataracts in both eyes. So sometimes just getting the cataract surgery can help reduce the fall risk. And then the third major thing we have with older adults is falls related to bifocals, trifocals, and progressive lenses. A lot of times these folks will trip on curbs, steps, ramps, or inclines. For example, my grandma, when she was going to CVS to pick up her prescription, she tripped on the curb because she had a new pair of progressive lenses, and she looked down through the reading lens as she's stepping up the curb, and therefore she missed the curb because the magnification of the lower part of her progressive lenses was for reading, not for navigating curbs. And then she fell and scraped her elbow on the cement. So if you've gotten trifocals, bifocals, or progressive lenses, make sure that you are aware when you're navigating steps, curbs, ramps, or inclines that you could misstep if you accidentally look through the reading lens. Next slide, please. So regarding the solution for vision, it's to be on top of this. You've got to be on top of this. We know that the eyes change with normal aging. We know that older adults are more prone to eye diseases than younger folks. And so you want to get regular checkups with an optometrist to make sure your glasses are correct, and with an ophthalmologist if you have any eye diseases. And then if you have new bifocals, trifocals, or progressives, take caution when you're going up and down steps, curbs, ramps, or inclines. Next slide, please. The fourth category that we're going to discuss, helpful tips, is regarding home safety. So this is environmental hazards. So typically what happens is when people get older, they don't need the big house anymore that they used to live in, and they can downsize into a smaller living space. to either save money or just to, make everything more accessible. And so a lot of times people want to cram all their furniture into a smaller apartment or condo or senior living community. And that's a big thing. So it causes the walkways to be cluttered, and it causes people to have to sometimes turn sideways to walk through their kitchen or their dining room if they have too much furniture in their smaller place. So that's first things first. If you're downsizing to a smaller living space, unfortunately, you're going to have to probably get rid of some of your stuff so that your place is not too cluttered. You want to be able to walk through all the walkways facing forward and wide enough that you could use a walker if you needed it in the future. And so you don't want to have to turn sideways and shuffle between things to get around. Also, we want to be aware of hazards on the floor. So, common things people trip over are wet areas. Like, for example, I know a patient who fell because her housekeeper came and waxed the floor. And she forgot the housekeeper was going to be there waxing the floor. She stepped on the floor, slipped, and fell. And so, that's an example of a slippery floor causing a fall. Of course, if there's water or urine or something else on the floor, you want to avoid the puddle and either clean it up yourself as soon as possible or get someone else to come and clean it up so you don't slip and fall on a wet floor. Throw rugs are a big cause of falls, and some solutions for throw rugs include either just getting rid of them altogether, so throw it out, or get one that has a non-skid bottom, or get double-sided tape for rugs and tape it down on the edges. So those are all different options for dealing with rugs. And then the other issue that comes up with normal aging is that because of normal aging of the eyes, which we already discussed is an issue, people tend to need more light than they used to need to see the same things. So a dimly lit room maybe was okay when you were younger, but now getting older, we need more lighting, and people may be more sensitive to glare. So we want to have appropriate lighting, that the room can be well lit, but not be totally overwhelmed with glare from the windows. Okay, next slide, please. So regarding making your home safer, this is something that you can ask for help with if you have someone who says, how can I help you? Like a child or a neighbor or a spouse or a friend or a loved one that says, I want to help you out. How can I help you out? And you're thinking, I don't know what I could use help with. Well, this is something you can use the home safety checklist that we have with San Diego County's Fall Prevention Task Force, and have that person, that loved one, come over and say, let's go through my house with this checklist and see what changes need to be made. And please advance the slide. I think the checklist should show up here. There we go. So this is the checklist. We're going to send this out to you. Vanya's going to send this out to you after the presentation, along with the information for the free programs I mentioned for managing chronic health conditions and free exercise programs that are offered in San Diego County. You'll also get a copy of this home safety checklist. And what it is a detailed list going room by room with suggestions on how to make the home more safe to prevent falling. Now, why is this important? Because as I mentioned at the beginning, most falls in older adults occur by slipping or tripping on a level surface inside their own home. So certain changes to be made to the house could help reduce the risk of falling. Let's look at some examples. Next slide, please. Here's some examples of some low cost modifications to the home that many people decide to make the home safer as they're aging. So for example, upper left corner here, that's a reacher. If you've had a hip replacement or a knee replacement, you may have been given one of these at the rehab center before you went home. This is to help people pick up something off the floor if they can't reach it. Right below that is a tub bench. Now, this is a tub bench that would be for a standard tub that extends out over the lip of the tub. So you would sit on this and then spin your legs into the tub. But certainly there are smaller versions of these called shower chairs that would be put in a shower stall if you don't need such a big bench. And there's different options, but you want to make sure you have one that fits in with whatever type of tub or shower that you have. Also, top center there, we see grab bars. One of the active members on our fall prevention task force is called San Diego Grab Bar. It's a father son small business, and they do a good job installing grab bars. You can also purchase grab bars at like a Lowe's or a Home Depot, any of these home improvement type stores, and you can have them installed yourself, or a handyman can put them in for you. The key thing with the grab bars is that they have to be screwed into a stud. So that's the difference between a grab bar and a towel rack. A lot of people I've met tell me, like, oh, I just hold on to the towel rack when I get out of the tub. Well, what's the problem with that? These towel racks are just secured into the wall by a half-inch screw, and they're just in the drywall typically. So if you put any weight, any real weight on a towel rack, like if you're about to fall, and it's going to come right out of the wall, and it may even hit you in the head as you're falling. So you don't want to rely on a towel rack. You want to actually have a real grab bar that's screwed into the stud with like long screws. And the neat thing about this industry is that even just in the last 20 years, new grab bars have come out that are decorative. And so they actually look like towel racks. They don't look like grab bars. They even have some now that are designed to look like a toilet paper holder to put by the toilet. So it's a grab bar that's screwed into the studs, but it also serves the purpose of holding the toilet paper so that when your guests come over, they don't see grab bars all over your bathroom. It just looks like a normal bathroom with towel racks and toilet paper holders screwed into the wall. But sure enough, they're screwed into the studs because they are truly grab bars disguised as toilet paper holders and towel racks, and therefore your bathroom looks normal, but it's also safe for you to hold on if you need to. So those are just examples of how you can even disguise grab bars these days with the new types that are coming out, more decorative grab bars. And if you do sit down in the shower, you'll need to get one of these on the upper right corner here, the handheld shower hose. That's really important if you take a shower sitting down so that you can control the flow of the water onto yourself. And then the two other items on here, the rolling walker, I'll also mention a standard walker and a cane. Those are called assistive devices. So if you find yourself walking around your house, grabbing onto furniture with your hands, you might need a cane or a walker to support you. And the purpose would be for your safety and also so that you can be independent with things like walking across a parking lot, for example, where there's nothing to grab onto, just an open parking lot. You want to be able to get across that space by yourself without falling. And so that would be the purpose of like a cane or a walker, to keep you independent. And you can talk to your doctor about this. You can also see any general physical therapist should be able to help you get fitted for a cane or a walker and show you how to use it. And then the bottom right corner here, we have an example of an emergency call system. So this is really important in case you do fall, if you cannot get up, that you can call for help. And a lot of people have these now. Typically, they're a monthly cost somewhere around $50 a month for this kind of system. There's different options of these. So if you do want to get something like this, you might want to research. Some of these now are connected to satellites. So you can take your emergency call button and wear it on your person even when you leave the home. And then if you fell, say, out in the community while you were like going to the post office or something, you could still press the button and get help right where you are through a satellite connection. So it has a GPS and a satellite, and it works anywhere. And then other companies offer this type of emergency call system that's only localized in your home, say within 100 feet of the home, because that button is connected to a receiver in the home that calls for help. And so that button doesn't work if you go off your property and go somewhere else. You wouldn't be able to call for help if you fell. And then, my grandpa used a system where he always kept his iPhone in his pocket. And that was his big plan. If I fall, I'm just going to pull my iPhone out of the pocket and call for help, it worked for him. But my concern was always like, well, what if you fall and your iPhone gets smashed because you landed on it and then you can't call for help? So you just want to have a way to call for help. You can also have a system in place where somebody calls to check on you once a day, to make sure you're okay, so that if you do fall and land on the ground, you're not down there for too long. And then the final thing is you want to have a way for the fire department to safely enter your place of residence if you do call for emergency help, so they don't have to break down your door, because that's expensive to repair later. So an option here would be to get a lockbox. You can purchase a lockbox like at Home Depot, for example, and put a copy of your key in it, and then give the code for your lockbox to the local fire department, whoever would respond to your place of residence, or give the code to your lockbox to the emergency call button company, or a trusted neighbor or family member that could be available to respond in the event of emergency. And that way, if the fire department has to come to your house, they can open the lockbox, get the key, open the front door, come in and help you. But your front door doesn't have to get busted down by the fire department, which again is expensive to fix after the fact. Next slide, please. Okay, so now I want to talk about resources. We've gone over all the areas I wanted to cover: how to speak up with your doctor for chronic health conditions and medications, how to keep moving, including strategies on footwear, exercise, active daily lifestyle, going to physical therapy if you're not sure how to get started with exercise, and even specialized vestibular physical therapists if you're having dizziness, vertigo, or continued falls, even despite exercising. Then we talked about getting your eyes checked and getting your optometry appointment to make sure you have the right glasses, going to an ophthalmologist if you have an eye disease. We talked about making your home safer, and we had tips on that we just finished. So those are the four main areas that I shared helpful tips. Certainly I could probably do an 8-hour course with a lot more detail in any of these areas, but I think this was a good start for helpful tips for you to get started thinking about reducing the risk of falling. And so I want to end with a few community resources that I mentioned. One, if you go to this website, healthierlivingsd.org, that's how you can learn about the Feeling Fit Club, which is a free exercise program for older adults in San Diego that offers exercise in strength, balance, flexibility, and endurance, the four main components of fitness I mentioned. You can do these exercises seated or standing. You can go to a class. It actually streams on TV 5 days a week. You can watch it on the local cable station. You can get information about that if you go to this website, and you can order DVDs from the county, which they'll mail to you for free with an exercise band to do this at home. This is also the same place where you should be able to find the information on the free 8-week classes that the county offers on healthier living with chronic health conditions such as diabetes, chronic pain, and any health condition that's chronic. Next slide, please. So just to review, again, speak up, keep moving, check your eyes, and make your home safer. Those are the four main categories you want to take action to prevent falling. Next slide, please. If you want to learn more from me, I do have 3 lectures available on UCTV. You can view them on UCTV or on YouTube. They're all UCSD Stein public lectures that I gave on different topics. The first one was taking steps to prevent falls. That was 2016, so that information is not up to date, but it's a little more maybe in depth. The one in the middle here called Dizziness and Vertigo Research on Aging. It's actually called Part 1 if you go on YouTube. That's from 2017. That's my most popular online lecture. That one has over 3 million views worldwide. So that one's a really good introduction to thinking about dizziness for people over 50. And then I did a part 2. You can see all the way on the left there in 2018. I did speak a little too fast during that part 2 lecture. So if you watch that online, you can slow the speed down. On YouTube, you can slow the speed down, and then you'll be able to follow me a little bit easier. I over prepared for that lecture and I tried to squeeze too much in. So I did a little speed talking, but if you slowed the speed down of that part 2 lecture, that should still be valuable for you if you want to learn about dizziness. Next slide, please. And this is how you can reach me, Kim Bell, and you can reach me at betterbalanceinlife.com. I am a physical therapist with 22 years of experience, and I've been specializing in vestibular physical therapy, which means treating people with dizziness, vertigo, or chronic balance problems, or repeated unexplained falls since 2006. So I do this full time. I do a lot of cases, and I have a lot of experience. And you're welcome to reach out to me. I don't take insurance. I just do private pay, but I do screen everyone with a set of screening questions to make sure my services are right for you. And if I think your needs can be met by another provider that does take insurance, I will certainly refer you to someone else. So feel free to reach out to me and I'd be happy to be a resource for you. I don't charge anything to complete the screening process with people who reach out to me. Okay, next slide. This is the contact information for the San Diego Fall Prevention Task Force as promised. If you are interested in learning about what we're doing, or you want to join us on our monthly Zoom call, we do usually have informative presentations by different types of specialists on fall prevention from all over the country, actually. And then we do have sharing from local providers that offer different fall prevention related services. We are also having a meeting in person in July at the San Diego County headquarters on Claremont Mesa Boulevard. So you're welcome to join us on Zoom in April and May if you want. And then you could come, and usually June, I think we go dark. And then you could come in person in July to meet us in person if you want to learn more and network with other professionals who are interested in preventing falls for older adults in San Diego County. This is the contact information. Next slide, please. Okay, so we've got about 5 minutes for questions. I know we had at least one question during the presentation. So Vanya, if you would please let me know what questions you've received, I'll be happy to answer them.
I don't see any in the chat, but please feel free to go in the chat or raise your hand. Henry Pohl has one during the presentation.
I think someone had their hand up when I was covering the speak up part of the talk. And I said, I'll take the question later. I'm not sure who that was.
Yes, Henry Pohl.
Okay. Hello.
Hi, Henry. Go ahead.
Okay, I have 2 questions for
Sure.
you. The first one is anything you want to say about dehydration, because that's something that I believe, from my own experience, it's an important issue, and it's something that sometimes people just don't hydrate adequately, and I'm somebody who's made that mistake. So the second question, totally unrelated, would be any thoughts about balance programs such as Tai Chi? Thank you.
Yes. Thank you, Henry. Great questions. Okay, I'll answer the first one. I'll answer the second question first. Yes, Tai Chi, a lot of people feel it's very beneficial for their balance and stability with standing up on their feet. The San Diego County does have free programs for Tai Chi. And part of the handouts that I've sent in to Vanya that she'll be distributing to all of you include the information for the free Tai Chi programs that San Diego County offers. Thank you for highlighting that. So that's an additional program in addition to the Feeling Fit Club. So the Feeling Fit Club is more traditional strength, balance, flexibility, and endurance, seated or standing. And then the Tai Chi is a separate program that is also evidence-based, and it's offered for free through San Diego County, and that would be more for standing balance. Yeah, so some people do really like that program. And let's see, regarding the dehydration, I totally agree with you. In fact, if dehydration gets to the extreme, of course, people can even end up in the hospital from dehydration. It can contribute to low blood pressure, all these kind of things. Urinary tract infections can be triggered by dehydration. And of course, sometimes a fall is the first sign that someone has a UTI. And so, yes, I totally agree with you that proper hydration is important. I would say regarding that point, I would recommend for you to talk to your doctor, your primary care provider about a goal for hydrating yourself daily, because it does vary based on body mass index, activity level, and the weather, how much you should drink every day. And so that would be an individual recommendation based on your size, your activity, and how hot it is out. And then also uh, beverages like alcohol and anything with caffeine, so tea, coffee, or soda that has caffeine, or a drink with alcohol, does not count towards your daily goal for hydrating, because those are actually diuretics, so they actually make you pee more and they don't hydrate you. So you want to hydrate with something else like water, or water with electrolytes, or some other drink. And then along those lines, you want to be careful not to have too much sugar in whatever you're hydrating with. So for example, water with some lime juice or lemon juice might be a good choice, but not necessarily drinking 60 ounces of cranberry juice every day, because that's going to be too much sugar. So those are the kind of the ideas. And I do recommend for my patients, I address this with all my patients, and I do recommend for older adults to come up with a system to objectively measure how much they're drinking every day. Because why is that? Because a normal part of aging is the loss of the sensation of thirst. So with normal aging, people are just not going to be thirsty. And so drinking only when you're thirsty is not usually adequate to stay hydrated when you're over 65. So what I recommend for all my patients, and we talk about what would work for them, is to come up with a way to objectively measure their fluid intake for the day. So I'll give you a few examples of what can work. One of my patients might fill up a pitcher of water and say, I'm going to drink this whole pitcher of water by the end of the day, and just leave it in the fridge or leave it on the counter and drink it by dinner time so that they're not up all night going pee. Another, like my grandma, what she used to do is she had these glasses from the home goods store, and she would fill up all 5 of them in the morning and set them up on the counter. And then she would drink them throughout the day. And by the end of the day, all 5 had to be empty by dinner time. So that was her way to measure. You can also use a water bottle. You might use a water bottle and say, like, fill it up twice a day or something like that. So the key thing is to talk to your doctor about how much you should be trying to drink for fluids, and then have an objective way of measuring it and try to finish that amount by dinner time. Of course, you might not accomplish that every day, but that would be a good goal. And your fluid intake may change if you become more active, or if it's hot out, or if you're like working in the yard doing gardening, for example, you might need to drink more that day. But absolutely, I agree with you. That's important. And furthermore, because a lot of older adults have problems with their bladder control, leaky bladder, embarrassing accidents, like, oh, I was out with my daughter and I had to keep getting up, going to the bathroom, whatever. A lot of older adults that I've met will purposely dehydrate themselves and try not to drink water so they don't have an embarrassing accident. And so I've taken that even further in my method, what I do with my patients, and I've taken training from certified physical therapists that specialize in bladder retraining, because your bladder is controlled by a muscle. And so I actually have special exercises I teach my patients, and I also offer online on my website for an online course that people can purchase for $97 if they're not my patient, but they want to do this program. And it's for bladder retraining for men and women. So sometimes people need to do bladder retraining exercises so that they feel comfortable drinking the amount of water that they need every day without having an accident. So a lot of times that needs to be addressed as well. There are certain conditions that prevent people from improving bladder control, but those are, individually assessed. In general, bladder muscle can be strengthened through exercise, just like all the other muscles in our body. So you'd want to address strengthening the bladder if leaking of the bladder is preventing you from wanting to drink the amount of fluid you need. And I hope that answered your question, Henry. Thanks for asking that question. Probably have time for one more question and then we'll wrap it up.